We're going to go ahead and take a look again at the communications menu of the Clinical Nutrition Center patient chart. Why don't we pull up a different sample patient? I'm back here at patient search and searched for LAZ. Let's pull up imaginary patient Amy Lazarus. And if we want to go straight into communications, we can click communications. So remember, anything in the communications tab of the patient chart can be accessed right here on the left from communications at this point. We've already gone through the patient history and demographics. Now we're going to talk a little bit about patient messages. So the purpose of this table is twofold. One would be to receive messages from patients, either by email or phone, and two would be to record that we called a patient or that we wanted to email a patient. So the first table that we're looking at here is all messages, and that's what came up when we clicked communications. That's the same as if we select view messages from that menu on the left. And you can see here a listing of this patient's messages, the date of the message, whether it was an email or phone call, who the message was to, the subject, the message from the patient, the message to the patient. So let's go ahead and do some scenarios here. So this table works a little bit differently than some of the others you've looked at. So if a patient calls and you've got them on the phone and they want to leave a message for somebody, let's say the patient calls and wants to leave a message for the doctor. You go to communications, patient messages, record message from patient. So we're going to go ahead and take that patient's message down. And when you do that, you can put down who the message is for. In this case, we'll make it for Ethan Lazarus. What's the subject? Say, I'm hungry. Phentermine no longer seems to be effective. What should I do? And then completed no, we haven't addressed this yet. So if it was a message from the patient, you're already done with it, and you just wanted to document the call, you put yes. Let's go ahead and click add. And now you'll see a new message has been generated, dated today, 12/17. That's not completed for patient Amy Lazarus. Recording a phone call, messages to Ethan Lazarus, and the patient's hungry. And so, of course, since I'm logged in, I just had a message pop up in my inbox saying that I have a message waiting from patient Amy Lazarus. So in real time, when messages come in, they'll jump into my inbox here. It's in bright yellow, so I know that's probably important. Now, if the patient is in the patient portal and creates a message to me, that'll come to me securely so that I can access that from here too. It'll look just like this, but this will say it was an email. So I can address that question when I'm in this view. So again, if I ever needed to get back here, just come back to view messages. That's where I'm already at. And I can just click edit on that message and I can address it. So let's see. Now you can see there's a bunch more fields. So now I can say, let's increase phentermine dose. And I could call the patient with that instruction, or I can ask the staff to call the patient. So if I click here, yes, create staff to-do for front, the front will see a to-do pop up in their to-do box. Or I could just leave that blank if I'm calling the patient. You'll see a couple other fields here, completed. I'm going to click that as yes, although the computer would do that automatically for me once I edit this. And attachment would be a spot that I could use to send a file. Let's say the patient was calling and wanted information on phentermine. I could send her the package insert. I could just attach it and click send, and she'd have it waiting in her inbox, in her patient portal. Remember, the patient's inbox will only show emails, so I'd want to email that to her. So we're specifying the form of communication. Assuming I was just calling the patient, we increased her phentermine dose. I called her. We don't need anything else to do. Click edit. Message is done. So you'll see the message is no longer showing up in red. It's marked as done. So another time we might want to do patient messaging is if we want to call the patient. Let's say we want to call them and wish them happy birthday, or we want to call to check in on them in a week. For any reason the doctor asks the front to call, or the dietitian calls the patient and has something she wants to write down. She's doing a chart audit, and the patient tells her something. So we could say add message to patient, and in here we can send it to him by the secure messenger, or more commonly we'll probably be calling. And we could say message to the patient was called to check in. Great, so we could send this message and we could document that we called the patient, or whatever it is. We could say gave patient information on the new weight loss drug. She will schedule an appointment. So I've just documented my phone call with the patient, and I just talked to the patient, so I don't need the front to call. If I wanted the front to call, I just click this to yes, and the front will get a message to call. And if I were emailing again, I could email the patient a file if there was something I needed to send them. When I click add, this will go ahead and create the message. Again, this is documenting that I've already completed the message, so that message is already done. Alright, so we see we've recorded messages from the patient and added messages to the patient. And to clarify, receiving a message from the patient, either they can send it from the patient portal, or we can add it to document a phone call or a discussion or fax. A message to the patient means we originated the message, and we can send them a secure message, or we can call them, and that's how we document it. So it's important to note that messages that need to be answered will show up in your left menu, and then once they've been completed, they'll be cleared. So I hope you enjoy the patient messaging system.